Hi, my name is Makenzie Vorbeck, and this is my capstone for occupational therapy at Eastern Kentucky University. It is entitled Workplace Wellness, Ergonomics, and Injury Prevention. To start off, retail and jewelry staff are at risk for developing work-related musculoskeletal disorders, and that is just due to the nature of their role, including standing, sitting, just prolonged static posture, repetitive movements, and improper workstation setups. And I believe that this is true across many settings in the retail industry, not just jewelry. Musculoskeletal conditions significantly limit mobility and dexterity, which lead to negative long-term effects, including chronic pain, decreased productivity, and potential for early retirement, which are all things that you do not want in the workplace, no matter where you're at. And the whole purpose of this ALE capstone is to implement ergonomics in the workplace, introduce evidence-based modifications, which promote workplace wellness overall. Like I said, this capstone was done at a jewelry store local to me called Bengel's Fine Jewelry. I did it over 5 total participants, 4 being sales staff and 1 being the jeweler. And I had a few goals for this capstone being increased knowledge of ergonomic principles, improved body mechanics and correct use of equipment, and to decrease pain and discomfort in the participants. The methods. I did 3 things. First, I started off with a needs assessment, which included observations and workstation evaluations, which I have been certified to do through Ergonomics. I did staff surveys and questionnaires, and they were completed regarding pain and discomfort. And then number 2, the whole intervention was for the workstation setup. This included recommendations for chair, desk, which accommodate any user, which they can be found in the 3rd column at the bottom, a new jeweler's bench, a new chair with arm support, or a new jeweler's bench with arm support, a new chair, and new tools and tool storage, and they can be found in the 2nd column at the bottom. Education and training was done for all staff. There were many different deliverables, and micro breaks and stretching. Ergonomic resources, which included PowerPoints and posters. And number 3, I did an evaluation, which included questionnaires, individual interviews, and observations. The results included increased knowledge, improved ergonomics and body mechanics, and reduced discomfort. Overall, the staff said that they had reduced discomfort after the intervention, and some implications for occupational therapy. This was very important to me because I do not feel that occupational therapy is very well represented in the retail world, but I feel that it supports the OT role in primary prevention and workplace wellness. It demonstrates the importance of ergonomic intervention in improving overall health, performance, and job satisfaction. It promotes a proactive approach to reducing work-related musculoskeletal disorders. It highlights the value of occupation-based, client-centered interventions in real-world settings, which these were all very important to me when starting the project. Again, like I said, that I don't feel like occupational therapy is well represented in the retail industry, and I feel like this project really did a good job encompassing all that occupational therapy can do. And then the conclusion, implementing ergonomics and body mechanic education in a retail jewelry setting led to improved knowledge of proper body mechanics and ergonomic techniques, and this led to reduced discomfort among the staff. This overall was important to me, and I feel like the interventions that I did were very helpful for all the staff. And I had individual jeweler training, which resulted in more sufficient equipment use and overall workplace wellness. And you can scan the QR code under the references, and that will take you to a Google Doc with all of my references. Thank you.